Have you ever felt like you tried everything to lose weight and control your blood sugar levels without success? If so, it's time to learn about OZEMPIC, the medication that has been changing the lives of many people struggling with type 2 diabetes and weight management. Hello everyone, welcome back to our YouTube channel. In this exciting video, we will take a closer look at what is OZEMPIC and 10 things that you need to know about OZEMPIC. OZEMPIC is a brand-name prescription medication that is used to treat type 2 diabetes in adults, along with diet and exercise. It contains semaglutide, which is a glucagon-like peptide 1 receptor agonist, GLP-1 agonist, and it helps to improve blood sugar levels by stimulating the release of insulin and reducing the amount of glucose produced by the liver. OZEMPIC is given by subcutaneous injection using a pen device and comes in different strengths, each delivering a specific dose of semaglutide. It may be used alone or in combination with other diabetes medications, and it is not recommended for people with type 1 diabetes or those who have had pancreatitis. So without further delay, get straight into the video. 10 things you need to know about OZEMPIC. 10. Is OZEMPIC insulin? No, OZEMPIC is not insulin. While both medications are used to treat type 2 diabetes, they work differently in the body. Insulin is a hormone that helps the body use glucose by moving it from the bloodstream into the cells. OZEMPIC, on the other hand, is a GLP-1 receptor agonist that mimics the action of a hormone called GLP-1. GLP-1 stimulates the production of insulin and lowers blood sugar levels. 9. OZEMPIC for weight loss. How does it work? OZEMPIC is a medication that has been found to be effective for weight loss in addition to its primary use in managing type 2 diabetes. OZEMPIC works by mimicking the action of GLP-1, a hormone that is naturally produced in the body in response to food intake. GLP-1 helps to regulate appetite by slowing down the emptying of the stomach and increasing feelings of fullness. This, in turn, can lead to a decrease in food intake and subsequent weight loss. 8. How long can you take OZEMPIC for weight loss? The length of time you can take OZEMPIC for weight loss depends on your individual circumstances and treatment plan. OZEMPIC is typically prescribed as a long-term treatment for managing type 2 diabetes, and weight loss is often a beneficial side effect of this medication. However, the duration of treatment for weight loss may vary depending on your weight loss goals, medical history, and response to treatment. In clinical trials, participants were treated with OZEMPIC for up to 52 weeks, and weight loss was sustained throughout the treatment period. However, it's important to note that weight loss with OZEMPIC may plateau over time, and it may not be effective for everyone. If you are not experiencing significant weight loss, or if you experience significant side effects, your doctor may recommend discontinuing treatment with OZEMPIC. Did you all know this before? Stay tuned, because there is still a lot to watch. 7. How much OZEMPIC should you take? This will vary by patient, and it will depend on your health history, health goals, and lifestyle. However, most doctors will start patients on 0.2 milligrams once per week. It is important to take your OZEMPIC on the same day each week. After a few weeks, if you're not having adverse side effects and you're experiencing fewer blood sugar spikes after meals, your doctor may increase your dose to 0.5 mg. If you're still having blood sugar spikes with no adverse side effects, your doctor may increase your dose to 1 milligram once weekly or as high as 2 milligrams once weekly. 0.5 mg, 1 mg, or 2 mg may be your final maintenance dose, but that varies by patient. The maximum dose for OZEMPIC is 2 mg taken once weekly. 6. How to inject OZEMPIC. Check the OZEMPIC liquid in the pen visually before injecting. If there are any particles or discoloration present, do not use the pen. Before injecting, clean the injection site with rubbing alcohol. Change the injection site each week to prevent injuries under the skin. OZEMPIC is typically injected under the skin in the thigh, abdomen, or upper arm. Talk to your doctor about the best places for you to inject and how to rotate injection sites. How impressed are you by the above information? Let us know in the comment section. 5. Who shouldn't take OZEMPIC? If you don't have a prescription for OZEMPIC, do not take the medication. It is not recommended for use if you are pregnant, planning on becoming pregnant, or if you are breastfeeding. It is not recommended for people without diabetes, or those with prediabetes or type 1 diabetes without the guidance of a physician. Do not use Ozempic if you or any of your family members ever had medullary thyroid carcinoma, MTC, or if you have multiple endocrine neoplasia syndrome type 2, MEN 2. Do not use Ozempic if you are allergic to semaglutide. If you're interested in trying a GLP-1 agonist, but you're allergic to semaglutide, you may opt for Victoza, whose active ingredient is liraglutide. 4. Benefits. Ozempic is a medication used in the treatment of type 2 diabetes, which can be used alongside lifestyle modifications such as a healthy diet and increased exercise. It is also used to reduce the risk of future cardiovascular events in people with type 2 diabetes who also have heart disease. Ozempic has been shown to be effective at reducing blood glucose levels and can also lead to weight loss. It is administered once a week on the same day each week and is available in 3 different strengths to help individuals with type 2 diabetes reach their blood sugar goals. The dosage of Ozempic does not need to be adjusted in people with kidney or liver disease. Overall, Ozempic has several benefits and can be an effective option for the management of type 2 diabetes. 3. Common side effects of Ozempic. While Ozempic can be an effective medication for managing type 2 diabetes and promoting weight loss, like any medication, it can come with potential side effects. The most common side effects of Ozempic include nausea, vomiting, diarrhea, and constipation. These side effects are usually mild and resolve on their own within a few weeks of starting treatment. However, if these side effects persist or become severe, you should talk to your doctor. Other less common side effects of Ozempic may include headache, dizziness, fatigue, and abdominal pain. In rare cases, Ozempic may cause pancreatitis, a serious condition that can cause severe abdominal pain, nausea, and vomiting. If you experience any of these symptoms while taking Ozempic, you should seek medical attention immediately. Stay connected. Maybe we are just jumping into an end. 2. Response and effectiveness. Treatment with Ozempic 1 mg subcutaneously reduced blood glucose levels by 22% when fasting, 36% 2 hours after eating a meal, and 22% over 24 hours. Insulin secretion typically occurs in 2 phases following a meal, and Ozempic increased both first and second phase insulin secretion. Ozempic also reduced glucagon release by the liver by 8% fasting, 14 to 15% after a meal, and 12% over 24 hours. After Ozempic administration, the insulin secretion rate in people with type 2 diabetes was similar to that of healthy people. 1. With other diabetes medications. Depending on the other medication, yes. Ozempic can be taken in combination with metformin, insulin, or other medications, but be sure to ask your doctor if it will be contraindicated with any other medications you take, and make sure your doctor knows of every other medication you take before starting Ozempic. Ozempic cannot be combined with Wegovy, Victoza, Trulicity, or Mounjaro, however. These are other GLP-1 agonist medications, and it is dangerous to combine them with Ozempic. This was all about today's video. See you soon in the next video. If you enjoyed this video, we would love to hear how much you enjoyed it. Feel free to leave a comment. Be sure to subscribe to the channel so that you can see more awesome videos like this in future. Thank you.